Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Nephrotic syndrome. In nephrotic syndrome, there are these characteristics. First, in nephrotic syndrome, there is more proteinuria. The proteinuria in nephrotic syndrome is more than 3.5 gram per day. There is hypoalbuminemia is seen in nephrotic syndrome. Hyperlipidemia is seen, and this lipid will also get excreted result in the urine, resulting in lipiduria. There will be increased cholesterol increase will be seen. So hyperlipidemia includes there is increased cholesterol increase, increased triglyceride levels are seen, but LDH levels are LDL levels, that is low density lipoprotein levels, are almost normal. Edema is seen. Edema is mainly seen due to sodium retention. So these are the main features of nephrotic syndrome. Then edema in the nephrotic syndrome is due to sodium water retention. Edema due to in nephrotic syndrome due to sodium water retention, it is called as overfill theory. Bland urinary sediment is also seen in nephrotic syndrome.
thank you and thank you for watching.